We are going through high-yield practice questions for substance use disorders so that you don't get them wrong on your actual exam. Don't skip the tricky questions at the end. Question 1. A 42-year-old man is admitted to the hospital for routine knee surgery. 72 hours after admission, he becomes anxious, flushed, diaphoretic. His vital signs show a heart rate of 115 and a blood pressure of 160 over 100. He appears confused and reports seeing insects on the hospital walls. Which form of substance withdrawal is this patient most likely experiencing? A. Opioids, B. Cocaine, C. Alcohol, or D. Cannabis? The answer is C. Alcohol. This patient is presenting with delirium tremens. This is incredibly high yield on the USMLE and PRITE. Delirium tremens is the most serious form of alcohol withdrawal, which typically begins at the 48 to 96 hour mark. You need to know that. Key features include delirium, automatic hyperactivity, and visual auditory hallucinations. DTs can be fatal, which is why it's so commonly tested, and it requires aggressive treatment with benzodiazepines. Remember benzodiazepines as the treatment for alcohol withdrawal for the exam. Question 2. A 24-year-old man is brought into the emergency department after being found unresponsive in an alley. On physical examination, his respiratory rate is 6 breaths per minute. His suprus and his pupils are 1 millimeter in diameter, pinpoint. Which of the following is the most appropriate next step in management? A. Flumazenil, B. Naloxone, C. Thiamine, or D. Methadone? The answer is B. The patient presents with the classic triad of opioid overdose. This is incredibly high yield. You need to know that opioid overdose has respiratory depression, altered mental status, and meiosis, or pinpoint pupils. Naloxone or Narcan is the treatment of choice for opioid overdose. It's important to note that while flumazenil reverses benzodiazepines, you do need to remember that for the exam. In real life, it can precipitate seizures, and we usually don't use it if there is benzodiazepine overdose. Question 3. A patient with a long-standing history of heavy alcohol use presents with an ataxic gait, confusion, and horizontal nystagmus. Before administering IV glucose, which of the following must be given to prevent permanent neurological damage? A. Folate, B. Thiamine, C. Vitamin B12, or D. Benzodiazepines? The answer is B. Thiamine. This is high yield for the exam. The patient has Wernicke's encephalopathy. You have to know that it is characterized by a triad of ataxia, confusion, and ocular abnormalities. It is caused by thiamine vitamin B1 deficiency. Thiamine must be administered before the glucose because it's a necessary cofactor for glucose metabolism. And if you provide glucose first, it can actually worsen the condition or precipitate Wernicke's Korsakoff syndrome. Question 4. A 28-year-old female is brought into the clinic by her husband, who is concerned about her bizarre behavior. She has been staying up all night, seems euphoric, and reports a sensation of bugs crawling under her skin. On examination, she has dilated pupils and is tachycardic. Which substance is most likely involved? A. Alcohol, B. Cocaine, C. Heroin, or D. Marijuana? The answer is B. Cocaine. So cocaine intoxication presents with euphoria, dilated pupils, increased sympathetic activity, which is why you see the tachycardia and hypertension. The sensation of bugs crawling under the skin is also a classic finding. Overdose is deadly due to vasoconstrictive effects, and that can cause a heart attack or stroke. Question 5. A 30-year-old heroin user presents with intense anxiety, abdominal cramps, diarrhea, and rhinorrhea. On examination, he is yawning frequently and has prominent piloerection, which is goosebumps. Which of the following best describes the nature of this withdrawal syndrome? A. It is life-threatening and requires immediate seizure prophylaxis. B. It is extremely unpleasant, but typically not life-threatening. C. It is best treated with benzodiazepines. Or D. It is characterized by meiosis and bradycardia. The answer is B. This is obviously opioid withdrawal. You have to know how to recognize opioid withdrawal on the exam. It has flu-like symptoms, including yawning, lacrimation, rhinorrhea, and piloerection, GI upset. While the patients feel very ill, the syndrome is not life-threatening. And that is a huge distinguisher between opioid withdrawal and withdrawal from benzos and alcohol, which actually are life-threatening. Question 6. A 20-year-old man is brought into the ER with sedation and respiratory depression after intentional overdose. His friends state that he was taking pills for anxiety. The physician decides to use a specific reversal agent. What did the physician use? A. Flumazenil, B. Naloxone, C. Atropine, or D. Thiamine? The answer is A. Flumazenil. Flumazenil, as we discussed earlier, is a short-acting antagonist used to reverse the effects of benzodiazepine overdose. However, it must be used with caution because reversing the benzodiazepine can cause seizures in people with chronic benzodiazepine use. Question 7. A regular marijuana user is concerned about an upcoming employment drug screen. After heavy chronic use, how long can the THC typically be detected in the urine? A. 3 days, B. 7 days, C. 2 weeks, or D. 4 weeks? The answer is D. 4 weeks. You will be tested, especially on the PRITE, on how long a substance is going to show up on a drug screen, so you have to know this for all the substances. Marijuana is the most commonly used substance, and while a single use may only be detectable for about 3 days, in heavy use, it can actually remain detectable for up to 4 weeks because it is released slowly from the adipose or fat stores. Question 8. A 22-year-old man presents with extreme fatigue, vivid dreams, and a huge appetite after stopping heavy use of a specific drug 2 days ago. He appears severely depressed and admits to having suicidal ideation. This crash is most consistent with withdrawal from which drug? A. Alcohol, B. Cocaine, C. Benzodiazepines, or D. Morphine? The answer is B. Cocaine. You have to know withdrawal from all of the substances for your exam because they'd love to test on them. The cocaine withdrawal is characterized by post-intoxication depression, malaise, fatigue, hypersomnolence, increased appetite. It's the opposite of what intoxication of cocaine is. So remember that for your exam. While not physiologically life-threatening, these patients can become suicidal during cocaine withdrawal. Question 9. A 35-year-old smoker wants to quit and asks about Chantix. What is the mechanism of action for this medication? A. It is a long-acting nicotine antagonist. B. It inhibits the reuptake of dopamine and norepinephrine. C. It is a partial agonist at the nicotinic cholinergic receptor. Or D. It irreversibly inhibits adenosine. The answer is C. Chantix is a alpha-4-beta-2 nicotinic cholinergic receptor partial agonist. Read that a few times so that you recognize it on the exam. It mimics the action of nicotine to reduce rewarding aspects of smoking and prevents withdrawal symptoms. Wellbutrin can also be used for smoking cessation, but Wellbutrin works by inhibiting the reuptake of dopamine and norepinephrine. That might also get asked on your exam. Before I get into this last question, make sure that you check out the 2 substance use disorder videos that cover more frequently tested facts so you don't miss them on the exam. Alright, question 10. A 19-year-old female is at a rave and takes a designer drug that makes her feel a profound sense of closeness to others. Later, she is brought into the ER with hyperthermia, confusion, and myoclonus. She is currently taking an SSRI for depression. Which drug is most likely responsible? A. PCP, B. MDMA, C. Cocaine, or D. Cannabis? The answer is B. MDMA. So MDMA, or ecstasy, is a substitute amphetamine that releases dopamine, norepinephrine, and serotonin. So if combined with a SSRI, it actually can precipitate serotonin syndrome, and you'll see this show up on exams. This is characterized by autonomic instability, hypothermia, and neuromuscular excitability, myoclonus. So MDMA is well known for inducing a sense of closeness to others, so if you recognize that in the vignette along with the serotonin syndrome after going to a party, this is probably MDMA causing serotonin syndrome. Subscribe to get notified of new videos every week. Good luck on your exam.